Please mute yourself, everyone else.
Hi, good evening, everybody, and Happy New Year to everybody. Right, this is the first English session for 2025, right? This session basically is going to be a model for the rest of the session for this year, whereby that the content are actually shortened to between an hour, so that it will not be too long for everybody. So let's hope that we can keep it short as well as interesting as well. But without further ado, let me start. Today's session, we are talking about indigestion. Indigestion actually is a symptom. It's not a disease by itself, right? And between the indigestion symptom, actually, there's a lot of other conditions that can contribute to it. Among them, we know that people who are suffering from acid reflux, as well as people are suffering from peptic ulcers, are also displaying similar symptom of indigestion. Right. So let's go into the detail of it, and let's see how we can manage all these conditions. These conditions are actually quite complex, are chronic, and therefore there's no even today there's no real what they call solution, a medical solution to really fully sort of eradicate the problem of indigestion. Okay, let's look at the definition. What is indigestion? All right. The technical term for indigestion is dyspepsia. So the medical term for it, right? It is defined as a pain that lasts at least 1 month, which is at the upper abdominal side. Basically, it affects your stomach side more than the lower abdominal, which is the intestine side itself, right? So if you look at it itself, what are the symptoms? The symptoms are very often you feel that after eating, you feel that the stomach is full, right? You have branching, basically bloating, right? And early satisfied, which means that if you eat a bit, then you will feel that you're already full, and nausea and the pain. So the more common symptoms are basically after eating, you feel very full, and then bloating and branching. These are the more common symptoms that actually we feel when we have what we call dyspepsia or indigestion. Okay, how prevalent is actually indigestion? You look at here, right? Indigestion basically is one of the highest prevalence rate in the population, general population. Right? You can see the green bar here actually is account for up to 40% of the general population having functional dyspepsia itself, right? Followed by functional heartburn, which actually is an overlap symptoms to dyspepsia, right? And then chronic constipation, and followed by GERD. GERD basically is the gastric acid reflux. Actually, GERD is fall under the category of dyspepsia as well, except that it's a organic class types of dyspepsia, whereby that is due to underlying medical conditions itself, right? So if you look at another statistics here is that in terms of dyspepsia, which is actually the indigestion, which is not investigated, which means that most of the time when we have indigestion, we really rarely go and see a doctor unless the symptoms become very severe anyway. So hence for these are the cases whereby that we really don't know what are the causes of our indigestion problem. So we classify it as an uninvestigated dyspepsia itself. And you look at here, Singapore actually have a very high incidence of uninvestigated dyspepsia. Now, level mind about all these criteria of Room 1, Room 2, Room 3, Room 4. These are basically different clinical criteria of classifying symptoms of dyspepsia. But as a whole, if you look at it itself, Australia actually have a prevalence rate of about 25%, whereas Singapore actually have a very high prevalence rate of about close to about 33%, right? So it's quite common, a common problem basically. Okay, what are the major causes of indigestion? In here, you look at the statistics here, right? You can see that the major cause of it itself is fall under a category called functional dyspepsia. Basically, this is a category whereby that of unknown cause. We call it for indigestion that we really don't know the underlying cause or undetermined. We basically classify it as a functional dyspepsia. Then followed by GERD, which is the gastric reflux. Very common. Is account for about 21% of the dyspepsia incidents, and followed by peptic ulcer, running on the third 6%. Right. We would be discussing all these three types of indigestion. Okay. In terms of the types of digestion, the dyspepsia can be basically classified into two major groups. So we actually break down the dyspepsia into functional dyspepsia, whereby there's no identifiable structure or causes that lead to the symptom, right? And typically these symptoms of indigestion are actually chronic. That means perpetual and then often mild, not the severe types of that. There's no alarm feature usually with people who are suffering from functional dyspepsia, right? And another type of dyspepsia basically is we call it organic dyspepsia. This is basically indigestion that have caused by underlying pathological condition or diseases itself, right? Which means that it's a disease condition that contribute to the symptom of indigestion itself. Right. So in this case, the symptom of indigestion may be more severe and it can be progressive. That means getting worse over time. Right. And very often they are alarm feature, right? Which means that usually with this itself, when we have a disease condition that contribute to indigestion, very often you might also have symptoms of weight loss, right? Sudden weight loss, or you have anemia, or what they call lack of red blood cell. Okay, so the way to diagnose it itself basically is that we basically want to detect using diagnostic finding itself, right? Now, very important for us in this session is to learn to differentiate between the types of dyspepsia if you are suffering from it itself. The reason is very simple. If your dyspepsia or indigestion is due to functional, which means that it's not really have an underlying condition itself, right? Then the treatment are very different, right? The treatment of dealing with functional dyspepsia basically is actually through the diet, lifestyle changes, and having some medication that can suppress the symptom, right? Whereas if you are suffering from organic indigestion symptom itself, which means that the treatment will have to be targeted towards the underlying causes or disease condition itself. So hence why it's very important, right? In going through this session, I want you all to understand that the first thing in knowing how to deal with indigestion is to learn to differentiate between your digestion. Is it due to a functional or is it organic cause? Okay, here let's talk about the majority cause or one of the biggest cause of dyspepsia, which is functional dyspepsia, right? What are the actual reasons for us having indigestion that's without underlying cause itself? And the pathophysiological mechanism actually is basically due to it's due to a disorder of a communication between your brain and the gut. Basically, it's actually there is a communication problem between your brain and your intestinal system, right? And this resulting in all the symptoms of functional dyspepsia. So what are the actual trigger cause? Example is stress and anxiety, because actually it affects your brain and actually that trigger affects your stomachs and the digestive system itself. So very often, a lot of people who suffer from functional dyspepsia, actually the trigger is often psychological due to the stress itself. Another trigger factor can be due to your gastrointestinal microbiome, which means that your food that's in the stomach itself, the bacteria is not balanced, not good bacteria, and you have a lot of bad bacteria in there. That means you're taking food that's actually having causing imbalance in the GI microbacteria. Also, another factor can contribute to this problem is actually due to inflammation of your gastric system itself, right? So important is that functional dyspepsia have no underlying causes, but it can be triggered by a lot of risk factors. And we will talk about what are the risk factors that we should avoid when we have this problem. Okay, so we just mentioned that functional dyspepsia itself is actually the problem between the brain and our GI system. So therefore, the first risk factor that we have to consider is actually the stress, right? Stress, depression, and anxiety disorder or history of trauma, all right, are actually one of the major risk factors that can contribute to functional dyspepsia. Right. Another factor actually is your lifestyle. So in this case, these are the things that we can actually change, control. Example are irregular eating patterns, skipping meals or overeating too fast or eating during stressful situation. And then you're having diet of high-fat food, spicy or high-sugar food, and drinking too much of caffeine, alcohol, or carbonated beverages, right? Or even smoking, cigarette smoking. These are all the factors that could actually trigger indigestion. Another risk factor for indigestion is actually medication. Medication can also cause indigestion. Among them, one of the most significant contribution of indigestion as well as on our condition called gastric ulcer is actually a medication that we take as painkiller like aspirin and NSAID, right? So these are, in fact, aspirin and NSAID are one of the major cause of peptic ulcer. We will talk about it later, all right? And actually contribute to the sign of indigestion. Other medication like antibiotics, right? Oral contraceptives like estrogen, oral contraceptives, taking iron supplements, taking steroid medication, right? Steroid is actually for inflammation, right? Taking thyroid medicines actually for thyroid diseases itself. All these medication can give you or trigger a sign of indigestion as well. So if you are on this medication, be aware that your indigestion is not really due to other underlying conditions. It could be a side effect of the medication itself. Okay, what are the current treatment for functional dyspepsia? Right, the current actually standard treatment is using a medicine called proton pump inhibitors. Right, so this is actually first choice treatment for functional dyspepsia. For those who are with this medication, you should be familiar with the PPI called omeprazole. This is a very common medication, first-line medication for people who are suffering from gut or peptic ulcer as well, right? So the problem with this is that the current treatment for functional dyspepsia using PPI, right, is not a solution. It's not an effective solution. First of all, taking PPI, you have minor side effect of sometimes have gastric symptoms, including nausea, abdominal pain, flatulence, constipation, and diarrhea. But the real serious issue actually is that when you take it for long term, right, you have the risk of kidney disease, liver disease, cardiovascular diseases itself, right? At the same time, also it affects your digestion of actually nutrients, and therefore most likely that if you are on long-term PPI medication, you will be short of vitamin B12, iron, magnesium, and calcium. So therefore supplementation of B12, iron, magnesium and calcium are one of the recommended supplementation for people who are on PPI regime. Okay, now we have said that the Western medication PPI are not very effective for treating functional dyspepsia, right? The alternative actually is that on the TCM side, there's also an option for people who are having a problem with long-term taking a PPI or have concern with taking PPI, right? In here, I just list it for everybody's reference. In TCM, there is also an medication called Xiao Yao San, right? So in short term we call it XYS itself, right? And this Chinese medication formulation has been also been proven to be a potential candidate for the treatment of functional gastrointestinal disorder. So for people who are actually having problem with PPI, you might want to consider a TCM option. Okay, another non-PPI option actually is use of probiotic as a therapeutic supplement. In fact, probiotic, okay, is actually recommended for the treatment of functional dyspepsia because of its high safety profile, right? You take probiotic for long term, you won't have any concern at all, and you do not have any short-term side effect either. So therefore, it's recommended for people who have concern of taking PPI. Probiotic is a viable alternative itself, right? So I have here all the study that on the probiotic itself. You can take the reference as it is. These are all one of the reputable study itself. One from Lancet itself. One actually is from another study, which is actually from a US clinical trial. Okay. Indigestion, we talked about the functional dyspepsia just now. Now let's go into the organic types of dyspepsia, which is indigestion that's due to diseases. Underlying causes is due to diseases itself. In here, you see that actually two of the major contributing factor to the disease are actually the gut, which account for about 20 to 40% of the organic dyspepsia, and the gastric and peptic ulcer, which account for 15 to 30% of the organic dyspepsia itself. So of course, there are other gastric malignancy condition that can also give us the symptom. Example like stomach infection, right? Gastric cancer, right? Pancreatic or biliary tract diseases, even gallstone, for instance. All these can also give us indigestion symptom. Other medical condition like irritable bowel syndrome, right? Celiac disease, which is a case of gluten intolerance, right? Hypothyroidism, Parkinson's diseases, which is a central nervous system disorder, multiple sclerosis, which is a neurological disorder, and pregnancy also can actually trigger the symptoms of indigestion itself. So you can see from here that actually there are a lot of underlying conditions that can give us a symptom of indigestion, right? And we really have to understand the differentiate between this and the functional side, right? Today we're going to talk about the gut as well as the peptic ulcer. These two major categories of organic dyspepsia, and see how we can well manage them. Okay, so let's start with peptic ulcer. Peptic ulcer is actually open sores on the inside lining of the stomach and the upper portion of the small intestine, which is the intestine actually near just outside the stomach, just coming out of the stomach. So these are the two common areas whereby you have ulcer, right? One is in the stomach, one is actually in the duodenum itself, all right? So what are the causes of peptic ulcer? Two common causes. One of them is actually caused by bacteria. We call it Helicobacter pylori. Helicobacter pylori bacteria, or H. pylori in short, right? And the other one actually, as I mentioned, is taking pain reliever like aspirin and NSAID pain medication. So taking pain medication can be a major cause of the ulcer itself. You can see from here there's some statistics. Up to 30% of people who take the pain medication NSAID regularly develop peptic ulcer. 50% of the peptic ulcer are caused by overuse of the NSAID itself. So which means that if you are on long-term medication of NSAID itself, you have a very high chances or risk of actually having peptic ulcer itself. Okay, let's talk about the other cause. The cause of peptic ulcer is the bacterial infection, H. pylori infection itself. Well, what is H. pylori? H. pylori infection actually is a bacterial infection that infects your stomach, right? This usually happens during the childhood, and it is a very common cause of stomach ulcer itself. In fact, more than 50% of the people in the world actually has already been infected by H. pylori. This is a statistic reported by WHO. Okay. So how H. pylori bacteria is being passed on? Usually passed from person to person through direct contact with saliva, vomit, or stool. Right. So in Asian culture, especially in the Chinese culture, we tend to share a lot of common eating utensils, and this is one of the major transmitting route for actually the H. pylori infection. And that's why that you can see that in China, the prevalent rates of H. pylori infection is very, very high. This is basically because of the way traditionally we have been sharing food, sharing common utensils, and therefore this is where the transmission of this bacteria is being prevalent. What are the complications if you're having ulcer? All right. One of the common, very obvious one is bleeding, right? Because they have a hole in the stomach, right? So it causes bleeding. Bleeding itself is the loss of blood, and therefore you can be slow loss of blood, which causes anemia, or a severe loss of blood, which can be an emergency itself, right? Another more serious complication actually is that because the ulcer creates a hole in the stomach or your intestinal wall, actually it will allow the bacteria to enter into your abdominal cavity, leading to infection, right? And this infection can lead to a very life-threatening condition called septicemia, which is sepsis. So that means that the infection can be lead to a very serious life-threatening condition of sepsis itself. So henceforth, right, very important is that if you are having peptic ulcer, you must seek treatment. Seek treatment. Okay, so the peptic ulcer, all right, we talk about H. pylori infection is one of the cause of peptic ulcer, but reality is that the more serious consequence is beyond just having a gastric ulcer. In fact, a H. pylori infection is associated with about 60% of duodenal ulcer and 40% of gastric ulcer, but it actually eventually leads to we call a stomach cancer. Right? H. pylori actually causes 90% of stomach cancer, right? And if you look at it itself, you can see that now it's from symptomatic gastritis, and eventually about 1% of people who suffer from this itself will develop gastric cancer itself, right? And remember, as I mentioned earlier, right, in China, half of the stomach cancer patients are occur in China. And because China have a very high prevalent rates of actually H. pylori infections itself. And to mention that, and I want to mention that how important is to prevent this gastritis infected by H. pylori to progress into stomach cancer. You look at the stomach cancer's survival rate, 5-year survival rate itself. Even at the localized stage itself, the 5-year survival rate is only 76%. So if you allow it to progress into the regional stage of cancer, the survival rate is 36%. And in fact, when it's metastasized, actually the survival rate is less than 10%, which is a very, very deadly cancer. So therefore, early detection and prevention is key to gastric cancer prevention. Okay, now what are the treatment for H. pylori infection? There is a standard triple therapy as a first standard treatment. What is the standard triple therapy? Itself basically is using the PPI, one of the medication we just mentioned, plus 2 antibiotics. So this what we call the current standard treatment for people who suffer from H. pylori infection itself. Unfortunately, the treatment result or efficacy of treatment on H. pylori eradications are suboptimal. The reason is very simple. If you look at it itself, there's a chart here showing actually different country and their resistant to antibiotic resistant rate for different types of antibiotics itself, right? So you can see from here that among all the antibiotic, 4 common antibiotics that has been shown here, right? There's the 2 of them are actually in the triple therapy, triple therapy itself. And if you look at China, right, the antibiotic resistant rate is actually 60%, right? In Singapore, the antibiotic resistant rate for this particular types of antibiotic is actually close to up to 40%, which tells you that if you are using antibiotic therapy in treatment of the H. pylori, that's the reason why it's not very effective, because there's already a growing trend of antibiotic resistance in the user, and that's why that the current treatment is not optimal at all. Okay, now having said that, actually, fortunately, all right, we do have actually things that we can make the treatment more effective. And among them, probiotic is one of the most, what I call recommended adjuvant therapeutic for treatment eradication of H. pylori itself, right? So there are sufficient study today that can actually attest to the efficacy of probiotic as adjunctive medication in anti-H. pylori regime already, right? So these are the things that you can, I leave this here for you to refer. But basically, you can use it as adjunct as well as a standalone. Both are actually equally helpful for people who suffer from H. pylori. So probiotic has becoming a very, very useful supplementation for people who are suffering from H. pylori infection. Okay, another thing actually we can actually draw support from our vegetable and plants which contains polyphenol compound. So basically these are actually the food with anti-H. pylori effects. In here you can see the garlic, broccoli, curcumin, cranberry, grapes, licorine, which is actually ganchao, green tea, and all that, and so on and so forth. So generally speaking, most of the vegetable and herbs itself actually do have some form of anti-H. pylori effects, and therefore, if you're suffering from a H. pylori infection, having plenty of vegetable in a diet does help. Okay, now let's talk about the second organic cause of a major organic cause of actually indigestion, which is called gastroesophageal reflux disease. In short, we call it GERD itself. What is GERD? GERD is actually our stomach. You see, when this is a stomach, and there is actually a sort of a valve, a sphincter in here. Right, for a normal person, the stomach acid will not actually run out to the esophagus. Whereas for people who suffer from GERD itself, actually the sphincter actually are loose, and therefore it allows the stomach acid to actually run out. So we call it reflux itself. And this, our stomach acid is very acidic, and therefore, if the reflux of it itself actually basically burn your esophagus. And this is actually a picture. You can see that the esophagus lining being burned by the acid. So therefore, progressively, this part of it will actually be damaged. Okay, what are the clinical manifestation of actually GERD itself? Generally, if your symptoms are basically you'll find that you have black wash of food or sour liquid, and you'll feel that. You have upper abdominal chest pain. You have trouble swallowing. You have sensation or a lump in your throat. You are coughing. You have hoarseness itself, and then you have heartburn as well. So heartburn is one of the symptoms also you can feel after eating, especially at night when you're lying down, you're feeling heartburn itself. And then at night, you have ongoing cough, and actually you have worsening asthma. A vocal cord also have inflammation. These are the symptoms of people who are suffering from GERD itself. The complication of it itself is basically that in esophagus, it will cause ulcer, right? You will cause abdominal narrowing of your esophagus itself, and you have problem in swallowing, right? In the mouth, right? You can the acid reflux can actually damage your teeth, can have a bad breath, and cause bitter mouth itself. You have a bitter mouth sensation, all right? And then ear, throat, and the nose itself, you will have all the inflammation and chronic cough itself. So these are actually the complication of clinical manifestation of actually GERD itself. Okay, now what are the risk factors beyond just only the symptoms and the clinical manifestation? Actually, having GERD itself, if you are not addressing it, the damage to your esophagus will progressively lead to actually eventually esophageal cancer, and this is actually the our major concern. Right? So esophageal cancer actually is a major GERD is a major contributing factor to actually esophageal cancer. So therefore, it's important that we have early detection and intervention on itself. What are the risk factors for esophagus? So one of the major risk factors actually we call hiatal hernia. Actually, basically, it's the bulging of your stomach, top of stomach diaphragm here. This is a picture showing you where this is bulging. So people who have this itself actually have the highest risk of actually having the erosive esophagus. Okay. Another one actually is obesity. Also is a risk factor, especially for people who suffer from central obesity itself, right? And if you're suffering from high triglyceride itself, you are also a risk factor. So these are the common risk factors for people who have a tendency to suffer from GERD. Okay, what are the medication and treatment options currently? Now, for GERD, most of us itself for short term, you will take anti-acid. Anti-acid basically is works quickly to reduce the amount of acid in the stomach. Basically, it works by neutralizing the acid itself, right? Unfortunately, this is only for short and quick relief itself of symptom, right? But if you take it too frequently, it actually can cause the reverse effect, and in fact, it make it worse. Or it can make it worse itself. So another common medication are considered is using the PPI, which I've just mentioned. The problem is that PPI, as we mentioned before, right, have long-term use of it itself increase the risk of kidney, liver, and cardiovascular diseases and dementia itself. Also, you will resulting in nutrient deficiency of B12, iron, magnesium, and calcium. So this is actually the current problem. So treatment for GERD on the medication side is still not optimal, and it will not solve the problem. It's only symptomatic relief. Okay, now what are the TCM alternatives for people who are actually say that, okay, now I do not want to take PPI, right, or have problem with taking PPI, right? So there is actually another TM formulation, we call it 半狭泻性汤 or 半狭泻性 decoction, right? And this decoction has been proven in use in China, use it for treatment of GERD as well. So therefore, for people who want to look for TCM alternative, this might be a reference for you to consider. All right, diet, right? What are the GERD diet? That means that what are the food that's actually suitable for people who suffer from gastric reflux? So here, before we talk about diet, I want to mention is that one of the major contributing factor to gastric reflux actually is irregular dietary habits, right? So this is actually a study we have shown that the irregular dietary habits possesses the strongest association with GERD itself. So if you want to control the GERD itself, try to have a dietary habit that is regular, do not want to actually skip food intake, meal or whatever itself, right? Dietary guideline basically cut down on the sugar, increase of fiber, so and then keep low fat or lean protein sources itself. Here are some of the functional food that we will recommend if you're suffering from gut. Oats, high in fiber, banana, low acidic food, right? And also can neutralize the stomach acid itself. And a banana are actually a very good source of soluble fiber as well. So ginger, right, is actually a natural anti-inflammatory herbs itself. Spices actually is very useful for people who have severe heartburn. Right? And then turmeric, turmeric itself actually, which contains curcumin, is known, a compound that known have anti-inflammatory effects itself. So I would recommend people who are suffering from gut itself, basically try to take more of the oats, take more banana, right? Have more ginger in your cooking, right? And turmeric in your cooking as well. Right. Also, of course, there's a tea we call chamomile, right? Yang but basically, it's a tea that you can use to relieve your gastric indigestion symptom. Okay, now what are the complications of actually having indigestion? I think you all know. So indigestion will lead to malabsorption. The malabsorption will lead to nutrient deficiency, which actually resulting in a loss of muscle and strength of body function. This condition actually will result in we are actually having poor health, right? Increased risk of fall, loss of independence, and also actually having a shorter lifespan. So, and it's not just only dealing with the symptoms and all that. Basically, the long-term complication of having indigestion is actually that you are going to suffer from nutrient deficiency itself. Okay, now why indigestion is such a complicated condition that are very hard to treat? You can see from here, I just want to share, it's nothing, just to share with you that we have actually 4 medical conditions. We call it functional dyspepsia, which means indigestion that we do not know the cause. We have GERD, we have IBS, what we call irritable bowel syndrome, and IBD, inflammatory bowel disease itself. These 4 are different, what they call category of condition, medical conditions itself. So they actually have a lot of overlaps and actually resulting in having an indigestion symptom itself. And therefore, actually, it's very hard for us to really differentiate, first of all. And therefore, if you cannot differentiate or even they have overlapping condition, it's very challenging for you to treat. For instance, that if you have a condition whereby that you have 4 medical conditions occurring at the same time, co-happening at the same time, and how are you going to treat it effectively? So it's very challenging to treat it. And therefore, it's important for us to realize that in reality, right, our condition, underlying conditions might be overlapping. And therefore, we can only at best result in reducing the progression of the disease and actually controlling the symptom itself. Okay, now, so here are the general recommendations for people who have indigestion. All right, it applies to all category of indigestion itself. First, stress is a trigger. Learn to manage stress, relax, and exercise. Exercise is a very good de-stressor. So, in the eating side, try to eat small meal, eat slowly. Avoid food that contain high acid, especially for people who are suffering from gut. So, reduce or avoid food and beverages that contain caffeine if you can. Cut back on your alcohol consumption, right? Then there are certain practice that you can actually also take on. Do not lie down immediately after a meal if you can. Not going to sleep until at least about 3 hours after the dinner will be a good, right? Quit smoking, right? Avoid tight clothing, depress your stomach, and do not exercise on a full stomach. Take an hour before or after a meal. Okay, now, what are the useful supplements that we can take for people for us who are suffering from chronic indigestion symptom, right? here are the recommendations. Curcumin is a very good one, right? In fact, it can actually provide replacement for people who are taking PPI. For people who are taking PPI, you want to take away, one of the options to consider is to consider taking curcumin as a supplement to see whether it can help to relieve a symptom. If you can, then you can actually do away with PPI regime. Melatonin is also used in combination with PPI, and it can actually be more effective than PPI alone in treatment for GERD. And then another one is actually the choice mastic gum. This is actually a gum defined in the European side, right? And it has been used quite commonly for treatment of a symptom of dyspepsia as well. Also, people who are suffering from indigestion basically need to supplement with vitamin D, because most of the people who are suffering from it itself actually are having a vitamin D deficiency as well. So these are common supplements that I will recommend for people suffering from indigestion. Okay, now let's talk about atomic side, right? So atomic side today we talk about probiotic has been very effective, not only for H. pylori eradication, it's also for functional dyspepsia itself. There's a lot of study on probiotic already. So in here, I just quickly run through. I think everybody is quite familiar with probiotic product now, right? For those who are not involved in atomic, I'll put it that way, just a short note of it itself. Never mind about atomic itself. Basically, you recognize the probiotic is important. So you can, of course, choose to take other probiotic, but if you think that probiotic is relevant, then you have your friends that are in the atomic side recommend to you, and you can actually sign up the number to buy from itself. Right. So atomic have two types of probiotics. One is a probiotic 10 plus, which is a powder form, right? The strength of the probiotic is 3 billion CFU, but it contains 13 strains of probiotic bacteria. Another one, which is a more potent one, is actually the SCI micro. This one I think only have listed currently in Korea and in Singapore as well, right? And it's in a capsule form. It doesn't have any excipient. It's only having pure probiotic bacteria in the capsule form, right? But the strength is 10 billion CFU per capsule itself, right? So generally, the powder form is for general health maintenance, right? Because the probiotic powder also contains enzyme and is quite good for general health maintenance. But SCI microbe is generally high potency probiotic that can be used for more therapeutic purposes. Okay, in here, I just want to quickly run through. You can see that the probiotic strain is a 12 strain of itself, and the application for the probiotic powder, powder one, basically digestive health maintenance, as I say, general maintenance, right? If you're having indigestion, you can take 1 to up to 3 sachets a day. Chronic diarrhea, also you can take it. Eczema, also can take it. And gestational diabetics, that means the pregnancy, diabetics during pregnancy, you also can take up to 3 sachets per day. Okay, the SCI, which is a higher potency capsule form of it itself, more targeted towards a series of more severe condition, right? So like C. difficile infection, travelers infection, diarrhea, upper respiratory tract infections, right? Asthma, even colon cancers, adjuvant supplementation, H. pylori eradication, right? And IBS, IBD, so on. Okay, another product that's relevant in today's topic will be the Atomy honeysuckle. Basically, it's a supplement that is actually designed to protect the stomach, right? So this actually Atomy honeysuckle has been having clinical effects or beneficial effect to protect your gastric mucosal membrane, and this is one of the clinical reports that show that there is effectiveness in it itself. So therefore, for people who are suffering from dyspepsia, right, actually trying out honeysuckle will be a good supplementation option as well. Okay, now then we talk about our dyspepsia will lead to malabsorption, and basically the problem is going to be a long-term problem of actually quality of life, right? So here I recommend for people who are suffering from malabsorption. So here you can see from here, one of the top recommended product is for people who are having malabsorption problem. It's best to actually also supplement with enzyme. Atomy enzyme supplement is one of the very good selection of enzyme, which is actually having 6 enzyme. We call it a full spectrum enzyme supplement itself. Then we have the 2 probiotic, which I've just discussed, and also we have multivitamin. This Power Vital Energy is a new launch product in Atomy, I think just recently, right? I have a pleasure of actually having a box from CH Tan, and I take it. I look at the ingredient. It's very, very comprehensive itself. Very actually, you will be more effective than people who are taking multivitamin tablet itself. So this is important for people who are suffering from malabsorption, malnutrition, because you really need a multivitamin product to cover all your deficiency that you might have. So for people who want to choose to actually be on, let's say, vegan or vegetarian side itself, then if you want to take alternative to a vitamin functional drink, you can actually choose pure spirulina. Spirulina is also can be considered as a natural multivitamin supplement as well. All right. Okay. Now the last item we talk about actually is just to quickly mention on the atomic enzyme, digestive enzyme. Why I say that it's a full spectrum enzyme is because actually if you look at under the ingredient list itself, atomic enzyme actually covers 6 types of enzyme. Among them, you will notice that there are 3 types of enzyme that's actually representing replacement for people who have pancreatic problem. These 3 enzymes are made out of the equivalent of our pancreatic enzyme. So for people who are suffering from pancreatitis itself, right? If you are having a problem with pancreatic enzyme secretion, this can be a very good supplementation for people for digestive enzyme. And I say that for malabsorption, in fact, taking digestive enzyme together with your meal is more important than taking probiotic itself. Okay, so the application of a fine enzyme is basically for indigestive symptom, indigestion, right? For malabsorption syndrome, as well as malnutrition itself. So this is one of the major application for fine enzyme. Okay, today, this is the end of my session, right? I have also leave the Chinese seminar notice in the chat board there, which is actually, I think, next week, next week, I think. So it's for people who want to join this session, instead of English session, and want to join the Chinese session, right? I will pass back the chair to Pauline now.